Building your support team is a very important subject to approach, especially when you just find out that you're pregnant. You know how a captain of any sports team, they know the positions that they have to fill. Just like a captain of a hockey team has different positions than a captain of a baseball team. So if you're captain of your birth team, you have to know which positions are going to be required, which are optional, and which ones are going to support you the best. And then we have the wonderful, amazing journey of interviewing different persons to see if they not only fit the role, but if they're also a good match for you. But one step at a time. Who needs to be on your birth team? So the support team that you need if you're going to have a cesarean is not the support team that you're going to need if you're going to have a home birth. If you're a high-risk pregnancy with a high-risk birth, you're not going to need the same sort of birth team as if you were a low-risk pregnancy. So we all know about doulas and our birth support and our midwives. But if you are deciding to have an out-of-hospital birth, whether that's in a birth center or at home, then you need to understand who exactly it is that you need for your team. Obviously, we need a midwife. She's going to be responsible for your prenatal care. She's going to be able to oversee low-risk pregnancies and low-risk births, your labor, your delivery, and your basic postpartum care. Then comes the birth assistant or the doula. Doulas tend to assist the midwife as well as birth assistants. They assist the midwife, they give you physical and emotional support, and they can help you with pain management and comfort measures throughout the delivery. They can offer comfort measures and advocacy. And also, they can support you, your support partner. If you also have other children who are also attending at your birth, having a sibling doula there to help comfort them and guide them through the process would also be an added benefit. Of course, all of this is all recommended. Having a doula or birth assistant is not mandatory. If you want to have other family members there at your birth, that is completely up to you. Again, it's not mandatory. You can have your other children involved at your birth, and you can have other family members also supporting you throughout your labor and your delivery. One other person to have during your postpartum period is your pediatrician. So now that you are pregnant and that you're looking to build your birth team, having that pediatrician ready for as soon as baby is born, so that way they can get a jump start on their first week of checkups and start following their development, so that way baby can get the best care in their first days on this earth. This birth team tends to be a little bit larger than a home birth team, and one of the other benefits is that there's not really so much to prepare. However, you can interview the birth team for your labor and delivery from the hospital as well. So usually what comes with a hospital birth is also the nurses. So there's a lot of labor and delivery nurses. A lot of them are very knowledgeable, and you can see how many years that they have experience, and you can ask them several different questions. They'll be more than happy to help you. When it comes to a hospital birth, labor and delivery nurses essentially are part of the medical care and support team for labor and delivery, but also for the postpartum period that you spend inside of the hospital. They administer medications, and they also assist with the C-sections and other medical procedures or interventions should there be any that arise. Of course, if you also have any medical interventions that require certain procedures, or even a C-section, or even if you want an epidural, who you're going to meet at this point would be the anesthesiologist. Now, they're going to be the ones to administer spinal blockers, I believe they're called, or epidurals. So if you're wanting medication to to be administered to you during your natural birth. If you do not wish for a C-section, or if it's not necessary, then the anesthesiologist would be the one to show up to administer you that pain medication. And then just like the home birth, you can have your doula or your birth assistant come in. Please make sure that they are okay with the hospital policies and that they adhere to the hospital policies as well regarding their role inside of the birthing room. Then you also have your birth support, which could be your partner, your doula, whoever else that you wanted there. Here's where the hospital differs slightly when it comes to the baby being born afterwards. Should you encounter having a premature birth, or there arises some complication with the baby that unfortunately was not found out during pregnancy, but now at the birth this complication has risen, there's no need to worry, because you have your pediatrician or your neonatologist. These two, especially the neonatologist, they deal specifically with preemie babies and babies who have any complications that arise with the birth. So even if you want to be careful and just be able to have them, available to you, you can also interview this person to find out who the best pediatrician is, because you're going to need one, especially for the first week of baby's life. And then just be able to stick with that doctor. You're going to need a pediatrician anyway, but should you also want a neonatologist, you can also interview with them as well. And last but not least, we come to the cesarean section. So whether you're having it planned or unplanned, it always helps to be prepared. Of course, you're going to have everybody that was previously mentioned. You have your doulas. Yes, there are doulas that help specifically with cesarean sections. You have your birth support partner, whether that's your spouse or somebody else. You have your nurses, your anesthesiologist, you have your obstetrician, and then of course your pediatrician and neonatologist, should they be also needed as well.